Hello. I'd like to share with you some details of our observations and recommendations in our article, Psychosocial Interventions in Functional Recovery in Schizophrenia, Realizing Opportunities Today, which is just published in the Journal of Clinical Psychiatry. And I'm going to do it in two parts. In the first part, I'm going to examine the framework of function in persons with schizophrenia and what the drivers of functional impairment in schizophrenia might be. In this first part, I will share with you our observations with regards to the factors that contribute to these functional impairments, and then examine treatments, tools that we have to address these drivers of the functional impairment. We'll focus primarily on psychosocial treatments because there has been a lot that's been written and that's available about pharmacological treatment. Again, I'd like to emphasize that pharmacological treatment is foundational in terms of helping persons with schizophrenia recover. But psychosocial treatments have a very important role as well. So the framework itself is, well, we know that persons with schizophrenia, if you examine the right side of the figure, in terms of functional recovery or the ability of persons with schizophrenia to lead lives of health and wellness, if you will, there are a number of different elements. And we know there are challenges with regard to function in persons with schizophrenia. So what are the drivers? Why? And the drivers of functional impairment are listed on the left. The disease burden. And there are some things that are intrinsic to the condition that are part of the clinical manifestation, the biology of the condition, some behaviors that accompany this condition. There are some comorbidities. There's the social context and the way that persons with schizophrenia are discriminated against, for example, in society. And there are broad societal barriers. So what can we do to address these functional impairments? And that's in the middle. We provide treatment and other services. And these treatments either work directly on the illness, the biology of the illness, the abnormalities in the condition, and reduce pathology, or we provide tools to the person with the condition to adapt around existing deficits. Those we broadly refer to as rehabilitation. And then we provide supports around the person with schizophrenia to help them lead more meaningful, productive lives, supported housing, supported employment, etc. And so essentially, that's what reduces the burden of the disease and enhances functional recovery. At the same time, whatever we do, whether it's our medications, for example, have side effects. So whatever we do has some unintended adverse consequences, costs, if you will, which are the treatment burden, which impair functioning. So obviously, what we want to do is reduce pathology and adaptation around the pathology while adding as little treatment burden as possible. Maximize the reduction in disease burden while minimizing the addition of treatment burden. And so this is a broad look at the drivers of functional impairment. Intrinsic drivers, intrinsic to the illness, behavioral drivers, behaviors that impair function that are associated with the condition, comorbidities and consequences of the condition, the societal contextual factors, and then there are systemic barriers, and then we add treatment burden as we try to help individuals with schizophrenia lead more productive lives. And this basically determines function in persons with schizophrenia. Now, in terms of refractory positive symptoms, which is one of the drivers of functional impairment, not noted here, but it's an important driver. There are pharmacological strategies such as more effective use of clozapine that are important in terms of addressing refractory positive symptoms. There are certain psychosocial strategies as well, such as certain kinds of cognitive behavior therapy that also helps address or reduce refractory positive symptoms. Negative symptoms. There are a whole range of evidence-based psychosocial interventions that help reduce, ameliorate negative symptoms. Cognitive behavior therapy, for example, targeting motivational deficits in schizophrenia, behavioral activation, social skills training, providing supports around the individual in the form of supportive employment, supported education, helping the family be more supportive, enabling, facilitating persons with schizophrenia to be more productive, to lead more meaningful lives, family psychoeducation. These are evidence-based treatments available to address the functional driver of negative symptoms. Cognitive impairment, another significant driver of functional impairment in persons with schizophrenia. And there are a whole range of treatments that address that. Social cognitive training, cognitive remediation therapy, metacognitive approaches, compensatory strategy training, and combinations. One of the things that's important to recognize that is that there have been a number of studies utilizing combinations of different psychosocial treatments, which have often been found to be more effective. So, for example, combining a cognitive remediation therapy with supported employment or social skills training. Diminished insight is another significant driver of poor function, leading to poor treatment adherence, for example. Again, a number of psychosocial treatments have been found to be effective in targeting those. Psychoeducation, both for the patient and the family, motivational interviewing, cognitive behavior therapy, and others. Lack of adherence. Now, if you think about behavioral drivers, the second set of drivers, behaviors associated with schizophrenia, which in turn are drivers of functional impairment. One of the big challenges, as we all recognize, is poor treatment adherence. And there are psychosocial strategies directed at this challenge of poor adherence, shared decision making, collaborative goal setting. There is a pharmacological tool as well in terms of long acting injectable antipsychotics. Adherence, there are specific adherence therapies, motivational interviewing, particularly useful, psychoeducation. There are a number of digital adherence tools that have just come into our armamentarium that are useful as well. Effective case management and peer support, another really important evidence-based tool to reduce poor treatment adherence. Substance use, alcohol, other substance use, as we know, is a significant challenge in terms of persons with schizophrenia and is a significant driver of functional impairment and sometimes not addressed. And there are very effective dual diagnosis treatment programs, again, motivational interviewing, cognitive behavior therapy, specifically addressing substance use. And there are modifications of CBT to target substance use, contingency management. So in terms of behavioral drivers too, there are a number of evidence-based interventions that are effective that we can utilize. Then there are the consequences of the condition, comorbidities, such as depressive symptoms, which often accompany a part of the condition as well, and defeatist beliefs that individuals might develop because of their challenges in functioning effectively. Now, there are a whole range of evidence-based interventions that target that particular driver. There's a form of cognitive behavior therapy that targets negative thoughts, behavioral activation therapy, social skills training, and certainly supported employment and education are helpful as well in terms of fostering mastery. Depression is often present in persons with schizophrenia and is a significant driver of functional impairment. There are effective treatments for the depression in terms of medications as well that need to be utilized. Loneliness, social isolation, another consequence of the condition that secondarily drives functional impairment. Social skills training, supported employment, peer-led programs, community engagement initiatives, digital peer support platforms, all evidence-based treatments for this particular challenge of loneliness, social isolation. Internalized stigma is a major barrier in terms of effective function and full participation in society of persons with schizophrenia. And there are specific psychosocial interventions, CBT, cognitive behavior therapy, structured psychoeducation, others that are effective in targeting that. Then there are a whole range of societal contextual drivers, which are a major challenge, which basically prevent or limit the ability of individuals with schizophrenia to fully participate in society. And discrimination, external stigma, a real problem. And I would suggest that we don't think about it just as stigma, but as systemic discrimination. It's something that society does to persons with schizophrenia, not giving them full opportunities for education, employment, discriminating against them in that regard, for example. And public education campaigns, CBT, workplace anti-discrimination policies and practices, supportive employment, for example, these are things that can help. Then there are a whole range of social determinants of health and socioeconomic status, which essentially, some of them secondary to the condition, some of them consequences of having schizophrenia, and some of them might actually be factors that may have increased the risk or the likelihood of developing that condition. And there are a whole range of evidence-based interventions that address those. Lack of family or caregiver support, an important driver. And here, the number of strategies to address that can be very effective in terms of helping persons with schizophrenia function more effectively. So there are a whole range of evidence-based psychosocial strategies that address the drivers of functional impairment in persons with schizophrenia. Now, the other thing that we noted was as we provide pharmacological medications, other treatments, each of these treatments can have some adverse side effects, if you will. And so we want to limit, we need to be aware of that. We need to monitor that and essentially limit that, reduce the amount of functional impairment that there might be. Collectively, we can do a couple of things in terms of addressing the broader systemic barriers in terms of access to care, access to health care. Persons with schizophrenia get poorer access to general health care. If a person with schizophrenia shows up at an emergency department for a non-psychiatric medical condition, the care they receive is inferior on average to that received by others. And so it's really important to be aware of the systemic barriers across a number of different fronts and recognize them, do something at a broader level to reduce these systemic barriers, but also be aware at an individual level in terms of which of these barriers are particularly germane in terms of limiting the ability of this patient in terms of functioning more effectively, and then target in an individualized manner. So the bottom line is we have to provide individualized treatment, individualized measurement-based care, recognizing that individuals are different. And in terms of the precise barriers, whether the intrinsic barriers, the systemic barriers, the behavioral barriers, the consequences, comorbidities, they're not the same across all individuals. They're different. So the treatments that we provide have to be individualized. And in the second part of our discussion on psychosocial interventions and functional recovery in schizophrenia, realizing opportunities today, I'll address the application of what we know to better improve the lives of persons with schizophrenia and address issues of implementation. Thank you all for your attention.